actively first. With our test possession, we only start at 90 degrees. I will have the patient go ahead and do the whole motion. So if you can just raise your arm up and overhead for me, as far as you can go, and back down. Perfect. All right, so active range of motion. Now, as far as our grading and assuming the test position, our full range of motion for the test position is 90. So that is arm straight out to 90. So for the patient to be able to perform range of motion, to be able to get a 5 out of 5, it is just up to 90. Okay, it doesn't necessarily have to be full overhead. Okay, and we'll talk a little bit more about that and functional limits and norms that we use outside of our true grade 5 out of 5. I do like the patient to be seated with feet flat on the floor. Again, like we did some of our other tests, this perpetuates good posture. If someone is lifted up too high, then their feet are going to be dangling, and that's going to put them in poor posture. And as we talk about with posture, and we'll talk again on shoulder next week, go ahead and slouch for me. If my patient is slouched, now raise your arm up and overhead for me. See how high she can raise. Okay. Now lower back down. Now get in your nice pretty posture. Beautiful, ribs are raised, shoulder blades are back. Now she lifts her arm up and overhead. Huge difference. You're looking at 30 degrees there. Okay, so making sure that your patient is in good posture to begin with, just like when we did our cervical and our skill checks and lab exams last week. Get them in a good position first, and that's going to set them up for the best movement possible. Okay, so I've checked her actively. What kinds of compensations do you think you might see with a flexion range of motion and muscle test? Leaning, exactly. Exactly. So if she's in a 90-degree position here and I'm pushing on her, she can lean, she can rotate, she can come forward. She may take her hand onto the table next to her and hold on. So make sure that you're watching for those compensations as well. Not tilting your head off to that same side to try to use upper trap. Okay? A lot of hiking of the shoulder, absolutely, absolutely. A lot going on here in this neck shoulder region, or tilting the trunk, twisting, lots of compensation. So tell your patient, I want you to stay in this nice tall posture. We're only moving at the shoulder, okay? And what the cues I like to give are always, hold this position, don't let me move you, okay? Don't say, try to push up against my hand or lift against my hand. I try to keep the patient still and say, you hold this position, not so much push against me or try to move me or anything like that. I like to say, you know, you're the Statue of Liberty and I'm the wind. I'm not going to move you, okay? So for this position right here, you will see some variations with hand placement, and depending on your height, you can vary but keep your own good body mechanics. Come into your test position right for me. If I'm at an okay position, an okay height, I can still flex my knees, get my body weight into it, and be in a good position. If this were someone taller, I may not be able to do that. I may need to come here and lock my hand around the arm and drop my weight this direction. So if I have a really tall person and I'm a short clinician, I may have to change my hand placement to here. But I'm still going to palpate, I'm still going to cue the shoulder and stabilize at the shoulder. Okay? So nice and tall, let me have you raise your arms straight out for me. Okay, hold it right there, don't let me push you down. Hold it, hold it, hold it, and relax. Okay? 5 out of 5. She held maximum pressure, no problem. She was even smiling. So if I, normal scale here, if I give her pressure, she breaks with moderate pressure. 4. Okay, what's 3?
No resistance.
She can get the position, but I give her resistance and she drops. She can't take any resistance. For a 2, I'm going to palpate. What muscles are creating this main muscle?
Anterior deltoid.
Anterior delt. Okay, I'm going to palpate anterior delt and see. Can you raise your arm up for me? If I can get a twitch here, then we're good. You may see a lot of 3 pluses with shoulder. I think oftentimes on shoulder you'll see a lot of the pluses and minuses just because there's some variation. So if someone isn't able to get full range of motion, but they are able to hold it with some pretty good resistance, I see a lot of 3+ with shoulder. Okay, so maybe they're down here, they're not all the way up to their test position. We'll see 3+ quite oftentimes. This is an easy one in the fact that all 4 grades are in the same position. You don't have to move someone. Okay.
You mean 2+?
What's that?
Did you mean 2+?
No, I mean 3+.
Oh.
I see a lot of 3.
Was like even.
Right, that's what I'm saying, is that even though they're not able to get to their full test position, which would typically give you like your 3s, I'll oftentimes see people get a lot of 3+ or 3-. So they can't quite get to the test position, but they can hold resistance, or they can not quite hold resistance, but yeah, there's a lot of gray area with the shoulder. So if you feel like you're in between grades, well, I gave a little resistance, but not much, go ahead and grade in between.
So they can hold, they're just not up at 90.
Right, they're not up at 90,
Okay.
exactly. So with a lot of our folks, think about full range of motion at 180 degrees, and I'm an 85-year-old kyphotic lady, and just mechanically, I'm not going to be able to get my arm up to 180 degrees. You will oftentimes see range of motions within functional limits, or your test position, maybe they're not able to get all the way to 90, but they can get most of the way there, and you can test them. We adapt our scale to some degree. So if I am trying to get into my cupboard, realistically, if I'm at 90 degrees and can reach my hand into my cupboard, I can do things functionally, even if I'm not at 180 degrees. So with range of motion, you might see within functional limits, WFL, instead of an actual number for range of motion. Or with the manual muscle test, again, we may not be doing a full brake test, or we may just be resisting through the motion. So oftentimes with geriatrics, you might see, okay, go ahead, lift your arm up for me, and you're just giving them resistance through it. Lift it up, lift it, lift it, lift it, lift it. Okay, and relax. So you're just giving some pressure through the range of motion instead of getting them in position and trying to break them. We don't like to break our elderlies. No. Okay?
What about hand position?
Hand position on this one, just right here is fine. If we want to do supraspinatus, we'll turn the thumb down. We'll talk about that a little bit more next week with some of the variations there. But with our general flexion, just palm down, just in this position is fine. And then kind of jumping ahead a little bit, if I'm doing abductions or scaption, as Brian mentioned this morning, it's the same exact test. You're just moving the arm into an abducted position or a scaption position. Okay, and then we can talk about hand placement next week. Yes?
So I'm a little fuzzy still on the 3 out of 5.
Mm-hmm.
So does it have to come to 90 to make a 3 out of 5?
Traditionally, yes. Traditionally, yes. But you may have populations, a geriatric person, someone with a frozen shoulder, someone who physiologically cannot get to 90. You can still give them a 3+, or you can still, if they can hold moderate resistance, but they're at 80 degrees instead of 90, I'm not going to dock them a whole number, a whole rating scale. So I can still give them 3, even though they weren't able to get to 90, but I can just make my notations that why they were limited.
Okay.
So the 3 is again no resistance.
3 is typically no resistance, but if I have a patient who's not able to get to 90, they can get to 80.
Still no
say.
resistance, but
Still no resistance,
But the
I
3
could still
plus
give them a
would be-
3. But if they can get to 80 and take moderate resistance
Then it's
at
3+.
80, I can give them a 3+.
Okay.
That makes sense.
I'll say that's
Thank
a 3+.
you.
okay.
Okay, and I'll just make a notation at 80 degrees of shoulder flexion because of whatever the limitation
makes
is. Yeah, so we can use our clinical judgment there. I don't want to say this person's never going to make any improvements. They're never going to get to a 3 or never get beyond a 3 just because they can't get to that 90 degrees if they have a certain issue going on.
Okay.
Okay, good questions. All right, so then if we were doing extension, could we get you improved? Facing out, so everyone can see this. All right, so we are using gravity or against gravity here. Our head position with our manual muscle test is the opposite of our range of motion test. So with our range of motion, you had the patient look which direction?
Away.
Away. So with manual muscle testing, they're looking to the same side. Okay, so they're actually looking, we allow them to use the muscles. We want them to use the muscles. So hand at your side with these. You're just gonna have them in a palm up position. Okay, they're gonna go through the same extension motion that they did with range of motion. So as far as your clinical organization, think about this. If I'm measuring manual muscle test and range of motion of extension, I can do them both from the same position, which is very, very helpful. Okay, so what we don't want to see with manual muscle testing of this extension motion, what might you see compensation-wise?
Bringing your shoulder up off this?
Yeah, if someone's trying to reach up and back, they're going to want to rotate and lift the whole front of the body and twist. You may see them really trying to almost laterally flex to this same side. You might see them even raising their head up off of the table. So as she comes into an extended position, you're most often going to see the full rotation. Okay, so we want to go to the end of her range of motion. Again, we talked this morning about normal range of motion. 50 to 60 degrees is a lot. So if someone can't get to 50 or 60 degrees, I'm not going to say they're not at a 3. Okay, so let's have you lift your arms straight up for me. It's pretty good motion right there. Okay, so I would say she's got normal range of motion. One of the other things you're going to see is the hand coming out to the side. So I'm going to cue her, keep your hand right next to your side as you lift up. Okay, so I'm going to take her through this range of motion here. I can see she's got the motion. Actively lift for me again. Nice, she's got the motion. Okay, so on this next go round, I'm going to give you pressure. Okay, so lift up for me, hold it, don't let me push you down, don't let me push you down, don't let me push you down, and relax. Okay, and relax your arm. So you can rotate. Oftentimes I will like to look at the patient's face, so I may stabilize at the shoulder, just feel what's going on with the shoulder and press, because which main muscle are we looking at, or muscles for extension?
Posterior deltoid.
Posterior delt, lat.
Latissimus dorsi.
So if I'm palpating posterior delt, if I'm trying to check for muscle contraction, I'm going to be right here. Kind of hard for me to do if I'm right here. So I like to pivot my feet. So lift up for me, keep your hand in towards your side, hold it there, don't let me push you down, don't let me push you down, don't let me push you down, hold it, good, and relax. So I like to have my hand right there on the shoulder. That's my preferred. In the video, they're showing this. But sometimes I think they just get out of the way so you can see in the video instead of them blocking the camera. So I prefer this position right here. Okay. Let's have you go ahead and sit back up. So same position again for all 5 grades. Can they get full range of motion, hold maximal resistance? Do they break with moderate? Can they get through the range of motion but they can't take any resistance? Then I'm just palpating for twitch, see if there's any movement. Okay. Excuse me. So with these, I'm gonna lower it down just a bit. So with these motions, did you notice where my resistance force was located? Exactly, it's proximal to the elbow, so we're using a short lever arm. If you come back into a 90-degree flexion position right here, if I'm pushing on someone's arm out here, I'm going to win. I'm not going to have any 5 out of 5s unless somebody's really, really strong. Okay, I'm not going to have any 5 out of 5s, so we give the patient benefit. These aren't very big muscles back here, so we're going to go proximal to the elbow, since the distal humerus is your force. Any questions on those? All right, let's practice those.
Really